Hello, I'm Dr. Singh, and thank you for interesting in me on your weight loss journey. If you're watching this video, then you're interested in starting semaglutide. So how does this medication work? Semaglutide is a GLP-1 agonist. So GLP-1 agonist pathway is activated when the food reaches your small intestine. Then it sends a signal to your brain letting you know that you're full. This medication increases the signaling of that pathway. So it will decrease your appetite, decrease your overeating and binge eating as well. The effect of this medication is not instantaneous, it's gradual and takes time. This pathway also decreases gastric motility and gastric emptying, meaning your stomach doesn't empty as quickly as it normally would, which will make you feel fuller faster and for longer periods of time. So how do you inject this medication? When you initially sign up for my program on my website, you will get an introduction email. In that email, I've included a video on how to draw up and inject insulin. Semaglutide is very similar to draw up and inject as well. When you initially receive the medication, it will come in a 2 milliliter or 200 unit vial. For my practice, I'll be using milligrams and not units, as units are changed based on which pharmacy makes the medication. The pharmacy I'm using right now is ACA Pharmacy. Any medication you get from ACA Pharmacy, your dose will be 0.5 milliliters or 50 units, regardless of the milligrams of the medication. As we go up to the higher doses, the medication is more concentrated, so you will still inject the same amount but have a higher dose. The medication will come with a 50 unit syringe, so you will use the whole syringe weekly. It may seem like a lot of medication, but it is not. It is only 0.5 milliliters of the medication. When injecting this medication, you should not feel any pain or discomfort. So please look at that video in the introduction email on how to draw up the medication and inject. Now next, let's talk about where you can inject the medication. The common areas are the deltoid, the triceps under your arm, abdomen, and thigh. Now if you have a fear of needles, a lot of people have tried putting ice for about 10 to 15 minutes on the triceps area under the arm, which numbs the area a little bit. So when you inject, you won't be able to see the needle and you will not feel the injection from the needle as well. So the needle that comes with this medication is a small needle. It's 1.5 centimeters long and it's a 31 gauge needle. The higher the gauge, the thinner the needle is. When you're injecting this medication, inject at a 90-degree angle and do it quickly. You will be injecting the whole needle into your subcutaneous area and then injecting the medication. Next, let's talk about side effects. About 30 to 40% of people on semaglutide will experience side effects, especially in their first month. Common side effects are nausea, upset stomach, indigestion, diarrhea, and rarely headaches. The best way to alleviate this symptom is to eat small, frequent meals. You can also use over-the-counter antacids such as like Tums or Maalox. Some people have also tried Dramamine and the over-the-counter seasickness medication for the nausea and have had good effects. If you're still having issues after trying these medications, you can try famotidine or Pepcid over-the-counter, which is a twice-a-day medication to decrease the acid in your stomach. If you're still having issues after trying all these medications, reach out to me so we can come up with a treatment plan just for you and may even prescribe you anti-nausea medications. I'm available to help you 24/7, 7 days a week. So don't hesitate to call or text me. I may not respond immediately as I may be with patients, but stay patient and I will get to you as soon as I can. Fatigue is another common symptom when you're trying to lose weight with these medications. And eating small, frequent meals will help with that as well. A lot of times if we stop eating, our body doesn't have the energy to burn fat, to use fat as energy. So eating these small, frequent meals will help us burn fat. So eating complex carbohydrates, nuts, and fruits will help with that as well. In clinical trials, most individuals do not have any side effects after week 3 or 4. This is how we can gauge if you can increase your medication dosage depending on the side effects you're having or not having. Next, I want to go over some of the frequently asked questions. First question I commonly get asked is when will the dose will be increased? So for semaglutide, we're going to start at the lowest dose, 0.25 milligrams for the first 4 weeks. And that's to get your body used to the medication so you don't have the side effects, or if you do, to decrease the effect of the side effects. After 4 weeks, if you're doing well, not having any side effects, then we can go up to the next dose up at 0.5 milligrams for another 4 weeks. And we will change the dose every 4 weeks from 0.25 to 0.5 to 1 to 1.75 until you reach your goal weight. The next question I get asked is, when will I start to see changes? With semaglutide, like I said before, the lowest dose, 0.25 milligram, is to get your body used to the medication. You may start seeing some appetite suppression, but you may not start seeing a big change in your weight, and that's perfectly normal. Don't be alarmed. As we move on to weeks 5, 6 onto the 0.5 milligram medication, you'll start to see that change in the weight at that point. Our goal is to lose about 5 to 10 pounds a month, which is a healthy weight loss. A healthy weight loss is a weight we can keep off. If you're not seeing the changes you expected to see, reach out to me and we can discuss your particular case and see what we can do to help with your weight loss. We may be able to add some medications. If you're not having any side effects, we may be able to increase the dose faster than usual, but reach out to me and we can discuss more regarding that. I want you to have a healthy, sustained weight loss because that's a weight you're going to keep off. So next question I get asked is, when should you contact me next? So as a concierge weight loss doctor, I'm available to you 24/7, 7 days a week. So you can contact me with a phone, text, email if you have any questions or concerns at any time. Other than that, normally we would retouch base at week 3 to see how you're doing in terms of your weight loss, your appetite suppression, and side effects, and talking about next steps and what dosage to go on next. And this will also help us get the medication to you on time, as the ACA pharmacy is taking about 5 to 7 days to send the medications out. So we have to get those medications ordered in a timely manner to get them to you on time. Next question is, how long are you going to be on the program? Most people are on the program for 3 to 6 months. Once we reach your goal weight, then we can start having conversations about what diet and exercise to maintain to keep that weight off that you lost. There was a clinical trial done with tirzepatide where they broke the groups down into 3 different groups after they lost their weight and got to the target weight, and they got off the medication. They monitored these patients. In the first 33% of the patients who made no lifestyle changes, no diet or exercise after they got off the medication, they went back to their old diet, they gained all of their weight back. In the next 33% of the group, they made some minor lifestyle changes, some diet changes, some exercise added into their lifestyle. They had about 5 to 10 pound weight gain, but they kept the rest of the weight off. In the last 33% of the group, people were very strict in their diet and exercise, and those individuals kept all of their weight off and stayed at their target weight. So adding some lifestyle modification like diet and exercise is very important after you get off these medications. Now, another question I get asked is, what else can we do in addition to this medication and diet and exercise? Well, there's some other medications we can use, such as metformin. Metformin has shown to have a 2.5 to 5% weight loss in conjunction with GLP-1 agonist medications. I normally don't recommend using metformin and this medication from the beginning, as metformin has the same side effects as these GLP-1 agonists, which is the nausea, upset stomach, which will just make your side effects much worse. If you're not happy with how fast your progress is going, we can talk more about adding these medications later on into your regimen. Lastly, there is some information on lipo injections which contain amino acids. Initially, we all thought that these injections causes fat burning and fat loss. In my research, I haven't seen any concrete evidence in these medications causing any significant weight loss. But if you're interested in trying one of these medications, reach out to me and we can talk more. Lastly, my goal, like I said before, is to touch base with you 3 weeks into your current dose. So if you have not heard from me by week 3, please reach out to me so we can talk about your next steps and the next dosage of medication. And as always, reach out to me for any questions or concerns. I will be there with you every step of the way. I'm available 24/7, 7 days a week to help you reach your goal. As you review this video, reach out to me to schedule your virtual consultation. And thank you for interesting in me in your weight loss journey.